Substances that we treat run the gamut. There's not really a substance that we don't treat. So everything from heroin, meth, prescription drug abuse, marijuana, we see it all and treat it all. It affects everybody a little bit differently. So I can, maybe I take heroin and it affects me in one way, and my partner takes it and it becomes something completely different. It really depends on the person. You cannot say that every time somebody does heroin, it affects them in this exact way. The same is true with every time you take something like heroin, it's going to affect you differently because there's different components, and you can't guarantee that the experience that you had today is going to be the same experience that you have tomorrow or was the same as yesterday. From 27 years of experience, does it affect the brain? Absolutely. You are definitely not the same person when you're on the substances, and you are not going to be the same person if you continue to be on any substance, whether that's drugs or alcohol, after a period of time. The chemical and how your brain not only receives information but processes that information will absolutely change. Detoxing off of substances versus alcohol can be different. So there are some substances that you may be taking that don't really, you're not going to necessarily detox. It's not going to look like an alcohol withdrawal, where if you're coming off of alcohol, you are withdrawing from that. They're physical symptoms. You don't feel good, you're nauseous, there's a lot of things that can happen with that. With drugs, not everyone's going to be a little bit different. You may feel some things physically that are annoying. You may be more anxious. You may be more hyper responsive. So little things are, the phone ringing is, the loudest thing in the world that you've ever heard, to you just don't want to get out of bed, to you're having actual physical cravings. You're wanting to find that substance to experience that high again. Everybody, I keep going back to everybody's a little bit different. Everybody's experiences in detox is different. And it's unique to that individual. Will everybody have some form and symptoms of something? Yes. The severity of it is going to vary from person to person. And that comes back to, really taking the person for who they are, and not, everybody goes, oh, you're a meth head, you're an alcoholic. It's different. Your experience is different, and our approach is recognizing that difference. We're going to really sit down and talk to you and try and figure out what is happening. If you're having symptoms from withdrawal, we're going to help you with that. I'm not going to allow somebody to come in and be admitted and say, this is absolutely 100%. We do this protocol for every single person, and here's your medication. Here you go. Not everybody needs that. And so we're taking that into account and really looking again at what is your experience, not only this time, but maybe previously, and how can we help you get through this the most comfortable way and safest way that we can do it. Nothing is too daunting, and reaching out for help and saying that you need that assistance is that first step, and there is hope and in recovery. You can get through this. Sometimes it just takes somebody walking the journey with you.